So a varicocele is an enlarged vein in the scrotum, and about 15% of the male population actually suffer from varicoceles. And about 40% of infertile men actually have varicoceles. And actually around 50% of the total infertility cases are male-related, with varicoceles as the most reported cause of male infertility. So just a bit of background on the testes. The testes are located outside the male body for a reason. The normal body temperature is hotter than the ideal temperature for sperm production. So the testes are actually suspended outside the male body because they should be kept at a certain temperature for successful sperm production to occur. The network of blood vessels in the testes supply the testes with oxygen and also regulate testicular temperature. However, varicoceles make heat regulation difficult because they actually block the flow of blood to the testes, which then results in infertility because the high temperature kills off the viable sperm in the testes. The condition is often accompanied with a reduction in the size of the testes and also a swelling of the scrotum. And most men with varicoceles actually experience a constant throbbing pain in the testes. There are also symptomless cases of varicoceles, and they're only diagnosed after a sperm analysis and a physical exam. So if you suspect that you or your partner may have a varicocele, get it checked out because the sooner the condition is discovered, the better your chances of addressing it are. According to the statistics on varicoceles, they appear to be on the left side of the scrotum more often. And as far as we know, there's no known explanation for this. And also they're more often found in tall and lean men. So there are various surgeries and other medical procedures for varicoceles, and the operation is generally quite simple and straightforward, which is why many doctors readily perform surgery on infertile men with varicoceles. However, only 30% of the patients who undergo surgery actually do experience an improved sperm count. So in other words, the remaining 70% of men who have the surgery, there's actually no improvement in their sperm count. And your doctor will not be able to predict whether your sperm count will improve after the surgery or not. So only 15% of men who undergo varicocele surgery actually successfully father a child. But there is actually options for varicocele treatment without surgery. And these are natural treatments which include a healthy diet, balanced lifestyle, and supplemental nutrition. So your goal is to improve the blood circulations, strengthen the walls of the veins, and also cleanse the reproductive system. Natural varicocele treatment actually includes eating a balanced diet with lots of fresh fruit and vegetables. So you can start eating whole grains and foods that contain essential fatty acids, also some wild fish and some nuts. Drink a minimum of 8 glasses of purified water every day, and try to opt for organic food over processed foods. You also want to avoid your intake of junk food, trans fatty acids, caffeine, and alcoholic beverages. Minimize your intake of animal products and try and favor vegetarian sources of protein instead. A diet rich in vitamin C and bioflavonoids will actually strengthen the walls of your blood vessels, and it also prevents plaque formation that can block your blood vessels. Plaque is a mixture of cholesterol and fats, and these adhere to the walls of the blood vessels and can also predispose you to cardiovascular conditions. In terms of supplementation, you need to complement your diet with about 1,000 milligrams a day of bioflavonoids, 1,000 milligrams of vitamin C 3 times a day, about 30 milligrams of zinc, and 400 IU of vitamin E would be sufficient. This varicocele treatment protocol actually also includes herbs. There are some herbs that have been shown to improve varicoceles, and these are damiana, saw palmetto berries, ginseng, and sarsaparilla. However, if you do want good quality supplements and herbs, so speak to your naturopath about accessing these supplements. It might actually sound surprising, but it is actually possible that yoga may have be an effective adjunct to treating a varicocele naturally. And, it can make sense too, because certain yoga postures can actually increase testicular blood flow. They flush out the pooling of blood from the varicocele, and they also cool the testes. So you may find benefits of this are an alleviation of pain, improvement in fertility, and also healing of the varicose veins. Yoga also improves general posture, muscle tone and circulation, and they'll all have the added benefit of relaxation as well. So if you'd like to try yoga for varicocele treatment, just Google it, and different poses will come up, and that actually may help you to improve your varicocele.